All right, it looks like the pings are starting to slow down, so we'll get started. Good morning, everyone. I'm Tiasha Fernando Backrack. I am one of the co-chairs for the SEOW, and I'll be facilitating today's meeting. I want to welcome you all today to our November meeting. It's hard to believe that we're already at November and at our final meeting of the year. Somehow it's already holiday season, so we hope you're doing well, taking care of yourselves, and are looking forward to learning and engaging with us this morning. So please continue introducing yourselves in the chat. As a reminder, keep yourself muted unless you would like to address the rest of the group, just so that we can keep our background noise quiet. And as a reminder, we will be recording this meeting and then making it publicly available on our SEOW website. So if you have any questions or concerns about that, please reach out to our coordinator, Junior Wadanasari at coordinator@coloradoseow.org. All right, I will turn it over for our next slide.
Good morning, everyone. I have the sad news that our first co-chair of the SEOW, Daniel V. Hill, died on November 6th. I met Daniel when he was a preventive medicine resident and had the great pleasure of working with him both at the health department as well as on this steering committee of the SEOW. Sharon, would you like to share anything?
Yeah, and I would also say it was a pleasure working with Daniel. He was always wanting to help out, loved data, and then he was part of our first iteration of the SEOW, and he led us through a very hard time through the SEOW when we had to work on what do you call that, rules or help me out, Peter. What was that? Oh, charter. That's it. Charter.
Charter. Yeah.
Yeah. So we owe a lot to him. He helped establish, he was one of the key people who helped establish the SEOW. So yeah, and then, you know, last we knew he was always a lifelong learner. So the latest was that he was enrolled in the Colorado School of Mines in data science. So.
And if anyone wants more information about a memorial service, they can email me.
All right, thank you, Sharon and Barb, for remembering Daniel. Oh my gosh. Okay. So we're going to take the next 10 minutes to connect with each other in small breakout rooms. Junior will be assigning you all to a room in a minute. So we just ask that you introduce yourself, your name, your organization, position, and what your favorite holiday season tradition is. And then discuss the following question: what are some of your favorite ways to communicate data stories with the public? And after 10 minutes, we'll all come back to our main room and start with today's presentation. Okay, perfect. Let's make sure everyone trickles in, and then we will cruise into our presentation this morning. All right, I think we've got everyone. I hope you enjoyed your breakout rooms and your conversations. If it's anything like mine, we just talked about holiday traditions and we didn't get to the data question, but that's okay because our next presenter is going to present on data stories. So with that, I'm so excited to introduce Julia Stullken, who is one of my colleagues here at CDPHE, to present on story mapping. Julia, if you are ready, you can take it away. I will stop sharing my screen.
Okay. Okay. Can you see?
Yes, yeah.
Okay. And can you still see it? Or do you see my, okay, great. I feel like it's a learning curve every single time I have to present something virtually. Good morning, everybody. I'm Julia Stullken. I'm the alcohol epidemiologist at Colorado Department of Public Health and Environment. And today I'm going to talk about a project that I've been working on over the past few years to monitor alcohol outlet density in our state. So first I'm going to do a little bit of level setting and talk about like what is excessive drinking, what is alcohol outlet density, why do we care about it? And then I'll move into some of the information about how we're monitoring it, how we're visualizing it, and some information about how to interpret alcohol outlet density once we measure it. I'll demo the Storymap that became publicly available last year, and then we can talk about some like final thoughts and next steps. So first of all, in case you're not familiar already, I'll probably be using the term excessive alcohol use throughout the presentation. And really, that's an umbrella term for these 4 different types of excessive drinking. So that includes binge drinking, which refers to the number of drinks that someone has on a single occasion, which is 2 to 3 hours. Heavy drinking, which refers to the number of drinks per week. And then any drinking by someone who is under 21 or someone who's pregnant. And then what's alcohol outlet density? So alcohol outlet density, or I may just shorten that throughout the presentation to outlet density, just for the sake of my voice. But outlet density is a measurement of the physical access to alcohol in a geographic area. So in other words, it's an indicator of the availability of alcohol. And throughout the presentation, I'm referring specifically to retail alcohol outlet density. So those are places that are licensed by the state to sell alcohol to the public, anyone 21 and over. There are a couple different ways that we could stratify alcohol outlet density and sort of disaggregate it. And some of those are by the license type or the premise type. So when I say premise type, I'm talking about on-premise outlets where like bars and restaurants, which are places where people go, they purchase the alcohol and they drink it there. And then there's off-premise outlets as well, which are places where people can purchase alcohol, take it somewhere else in a sealed container. So those are like our corner stores, liquor stores, grocery stores, places like that. There are a few license types in Colorado that are allowed to operate as both on and off-premise, and they're counted in both ways, like in the numerator in both ways. And then today, I'm mostly going to be talking about overall outlet density. So I didn't really disaggregate for this presentation, but just know that that option is out there. So in case you're not familiar, the Community Preventive Services Task Force is an independent non-federal body of public health and prevention experts. They review policies and literature pertaining to community health, and then they make recommendations available to the public in a document called the Community Guide. And they recommend regulating alcohol outlet density as an effective strategy for preventing excessive alcohol consumption and harms associated with excessive alcohol consumption. So higher rates of alcohol outlet density have been associated with excessive alcohol use, which in turn is associated with a variety of health problems, including injuries and violence, alcohol poisoning, fetal alcohol spectrum disorders, cancers and other chronic conditions, alcohol use disorder, learning and memory problems, etc. The other reason why we care about outlet density is that, or the excessive drinking in general too, is that it costs a lot of money. So a study done a few years ago found that using 2010 economic data, excessive drinking as a whole costs about $5 billion a year, and that's in Colorado alone. So I think just based on inflation, we can probably assume that that number has gone up. And then I also wanted to just take a minute here to note that Colorado does regulate alcohol outlet density to a certain degree. We're not very strict with it, but compared to some other states, but we do regulate the distance between liquor stores and the distance between liquor stores and K-12 schools. And so localities also have licensing and zoning authority. So we have a local control in our state. And so a local licensing and zoning authority could, in theory, make even stricter rules if they wanted to about the distance between outlets and things like that. So I just wanted to point that out before I go into the rest of the spiel about outlet density. So another reason why we care about outlet density is that it is tied to social justice and equity concerns. Since outlet density is determined by licensing and zoning policies, it's been heavily influenced by historic redlining policies that have lasting effects to this day on neighborhoods across the US. So all of these points here that I've made and the research that's cited on the bottom of the slide, this is coming from cities in the US. And the prevalence of alcohol outlets, particularly off-premise outlets, like liquor stores and corner stores, has been higher in communities where there's more people of color with lower incomes, despite the fact that those populations report lower levels of excessive drinking than their white, non-Hispanic, and affluent counterparts. So what does excessive drinking look like in Colorado? So this data comes from BRFSS, so it's self-reported. And then the green line at the top is current drinking, which refers to any alcohol used in the past 30 days. So about 60% of Coloradans report current drinking. And then about 18.7% report binge drinking. And that's that orange line in the middle. And I'll just note that these categories are not mutually exclusive. A lot of people that report heavy drinking also report binge drinking. So that last slide was overall drinking habits in Colorado. And then this one is looking at binge drinking prevalence by county. And then that's overlaid with alcohol outlet density by county. So you can see, and I'll show this map again when I get to the story map, but each of these layers is 50% transparency. So you can see that the areas that are the much darker red show visually where both alcohol outlet density and binge drinking are higher. So now I'm going to talk specifically about outlet density and how it's monitored. So in 2021, the CDC released a toolkit for measuring alcohol outlet density, and that's the graphic that's on the left. And I'll share these slides at the end, and there's lots of like clickable links and PDFs and stuff like that in here. So there's a lot of different ways that we could measure alcohol outlet density, and if you've ever read research papers and literature on outlet density, you may have noticed that some people have very complicated methods of calculating, like for example, the time it would take to drive between outlets, or the Euclidean distance, which is like as the bird flies, like what's the shortest distance. And those are great for research, but really hard to communicate and use and compare over different jurisdictions, et cetera. So the CDC toolkit really wanted to recommend some relatively simple indicators that are geared specifically to applied public health practitioners. And so these are the 4 indicators that they recommend. And the first 2 count-based indicators are pretty simple to calculate. You don't really need like any special software or anything like that. You could just use Excel as long as you have the right data. And they are expressed as a rate per square mile or a rate per 10,000 persons. And those population estimates come from the American Community Survey data, which is a supplement to the US Census. And then the last 2 indicators, the distance-based indicators, are a bit more difficult to calculate. They do require special software that has like GIS capabilities, but they do capture cluster dynamics. So the first 2 are strictly container-based, and then the second 2 capture a little bit of that clustering that can happen. And some people call that like hotspot mapping, for example. And so this is the toolkit and the information that I used to like develop this project. So a little more about the project is that it first started so I was a fellow hosted at CDPHE, and so this started as a fellowship project. And the first objectives were really just for me to learn how to measure alcohol outlet density and to determine the feasibility of using liquor enforcement data for ongoing surveillance of alcohol availability. So spoiler alert, I did learn a lot about alcohol outlet density. I'm always learning more about it. so I don't feel like the process is done. But I do use liquor enforcement data for ongoing surveillance. And basically that consists of me downloading licensee lists from the Liquor Enforcement Division. Those are publicly available records. And then I use their addresses to geocode them and then calculate the indicators. So I'm not going to go into a ton of like specific details about the methods for calculating and like cleaning data and all of that, but I'm certainly happy to answer questions at the end or connect offline if that's something that you're interested in. More about this project is that I wanted to get some input from various groups about like how to visualize the data and which of these indicators was going to be most useful to partners. And so I talked to folks in this group. We used to have an alcohol policy like subcommittee. I'm not sure if that's the right way to call it, but I met with that group several times and they gave lots of feedback and suggestions on early drafts of the story map and just ideas about like timelines and things like that. So I am very grateful to them. I also surveyed our program like stakeholders and state partners about which of the measures would be most useful to them. And so from that, I found mostly that they cared about the count-based indicators, so the rate of outlets per 10,000 persons and the rate of outlets per square mile. And they also wanted to see outlet density in like together in context with other factors such as excessive alcohol use and social justice issues. So now we'll talk about some of the results of that. So another thing that someone from the SEOW had recommended is using social math to help folks visualize what a rate of outlets looks like. And so this is an example of the social math that we came up with, and it's using Coors Field as sort of like the recognizable feature for what outlet density looked like in Coors Field if it was the same as the rest of the state. And that graphic, it exists, it lives in the story map. Folks can download it and use it if they want. And so the main way that I decided to visualize this data is through a story map. So Storymap is an Esri like storyboarding application, web application. And the reason that I chose Storymap instead of like a more traditional dashboard, for example, is that I really wanted, what I learned in some of the stakeholder meetings early on was that not a lot of people had ever heard of alcohol outlet density or used it in their work. And so I wanted to create something that would make sense to someone who has never heard of this and who is not a data expert. And so the story map is really interactive. It can be viewed on a variety of different devices. I don't recommend using it on a cell phone because the maps don't look great, but you could. And then it also includes like graphics and a lot of narrative and explanation for the different images that you see. And then for people who are data experts or who want to use this data, because this isn't my data, this is all Coloradans data. For folks who want to use this data for their own projects, the shape files and the data that I use to create the maps are publicly available on the CDPHE open data portal. And then the SEOW helped me put together this infographic as sort of like a static way to share information about what outlet density is and then point folks back to the story map if they want to learn more. So now I'm going to show the story map, and can you see the story map now?
Yes, yeah, it looks like you're on the web browser, Julia.
Okay, great. Gotta love Zoom. Okay, so the links that are in the slide deck that'll be shared, just as an FYI, the version of the story map that you'll see there is embedded in our CDPHE website, and the reason for that is so that we can like track how many people are using it and things like that. So it might look slightly different than what you're seeing now, but I wanted to have like the full screen effect. for the presentation. So when you go to the story map, it'll bring you to this landing page, and you can see in the bottom left corner, there's like this little arrow that's encouraging you to keep scrolling. And then there's a menu at the top, and as you scroll, this menu will follow you all the way down. And so if you're looking at the story map for the very first time, I recommend just scrolling from start to finish to get all of the information about what outlet density is, how it's measured, like what are the data sources, etc. But if you've used it before, you could just kind of click to each of the different chapters to see. So I purposely included this section on interpreting alcohol outlet density before we ever get to the maps, because, and we'll go back to this later as well, but there's a lot of nuance, and it is challenging to, once you have the measures of outlet density, like what do they mean and which one of them makes the most sense for your project or your community, etc. So I wanted to include some of that sort of context, and then some like guiding questions and thoughts for people to think about before they ever look at the maps of Colorado. And so some of these things are like, well, what is the overall population in your community? Are there things about that population that make it unique? So one of the main challenges, I would say, in interpreting outlet density is in these unique geographies where census estimates don't count the population. So like tourist destinations or like university towns, et cetera, where you have like this big influx of people that they do spend a lot of time there, but maybe that's not considered their permanent home. And then if you keep scrolling, then we get to these maps of outlet density. So all of the maps, so these three sections, Colorado alcohol outlet density, Colorado drinking behavior, and alcohol outlet density and health equity, these are all map slideshows. And each of these has this slide bar or side bar on the left that where I try to explain what you're looking at and maybe get you to think about one or two things from the map. So each of the maps is interactive. You could search for a specific county or place. You can zoom in or out. You can click on a specific point. So this map has two layers. It has the boundaries and it has the outlets. So what I'm looking at now is the information about the county boundary. And then I can hit the next little arrow here. And this is showing me the information about that point location. So this is telling me that this is a hotel and restaurant license. It's an on-premise outlet. It's in the city of Meeker, and like the latitude and longitude of it. But just looking at these point locations is interesting, but maybe doesn't give us a lot of meaning, and that's why we calculate density. So this first map is looking at rate of outlets per 10,000 persons in the county. And as you can see, I kind of spoiled it at the beginning by showing you the map with the binge drinking behavior, but outlet density tends to be higher when we're looking at per 10,000 persons along the Rocky Mountain region. And some of that is due to the fact that the populations in these counties is pretty low. But then this is what outlet density looks like if you calculate by square mile. So of course, maybe unsurprisingly to some of you, I don't know, the outlet density is going to be higher in urban settings when we're looking at square mile, because there's a lot more jam-packed into a smaller region. So I don't want to necessarily go through every single one of these maps and explain everything to you, because I want you to explore the story map after this presentation, but I will just point out that I included the first three measures of outlet density, so rate per square mile, rate per 10,000 persons, and average distance between outlets at the county level and at the census tract level. So once you scroll through the county, now you get to the census tract level. And then I also included maps of binge drinking estimates. So this is that 5-year prevalence estimate of binge drinking by county. And then this is that same map that I showed you earlier where it's overlaid with the outlet density. And then because we know that outlet density is tied to these licensing and zoning practices that historically have been very racist, we also included maps that show, so on the left side, these are ACS estimates of the percent of the population that are not white, non-Hispanic, so identified themselves as a marginalized community. And then on the right, we have the off-premise outlets, outlet density. And if you open, you can see the legends for both of those. So we have race, ethnicity. We also compare to the federal poverty limit, so that on the left now we're looking at the percentage of the population that is under the federal poverty limit. And then this is a map of Denver, and it's showing the off-premise outlets per square mile. And then these little lines here are representing where the redlining grades were given and to what community. So if you open it, you can see like what each of the grades meant. And the reason I only have Denver for this is because this is the only like redlining map that I have. If you work in a specific city, you may be able to find these maps like in your city or county like archives, but this is the one that I had access to. Okay, so I'm going to go back to the presentation. So before I wrap up, I just want to touch again on some of these challenges when we interpret outlet density. One of the questions that comes up a lot is like, well, what is a reasonable outlet density? And there really isn't an answer for that. I think that it's important to remember that, you know, the density indicators only tell part of the story, but people who live and work in the communities where we're measuring outlet density really are the most equipped to tell us like what that means in their community. And so I can't prescribe like a value that is high or low. In general, we like to say outlet density is higher or lower because we're just like comparing across rather than saying it's high or it's low. And then also it's important to remember that, you know, these county and census tract boundaries help us put the measurements into pretty little containers. But we all know as people that we travel, people and goods travel across those invisible boundaries all of the time. And so if you're looking at outlet density in your census tract or your county, for example, you may want to compare or look at, well, what does the neighboring county do? Or what does the neighboring census tract look like? Or how many people maybe work in this census tract that aren't being counted in the population, but are still being exposed to a higher outlet density, for example. And then, you know, how do we make meaning or use this data to inform decision making? And again, I think that's probably best discussed, like, you know, for the people who want to use it for decision making. But I think one step could be including these measurements in community health assessments, for example. So some next steps and just wrapping it up. Outlet or alcohol policy, excuse me, is really tied to the data that we use for the licensing. And so alcohol policy has the potential to change year to year through bills proposed in the General Assembly or through the ballot measure process. And so this can affect the comparisons of outlet density over time. I still think they're useful over time. It's just that you have to continue adding that context and that layer of information. For example, like when the 3.2 beer law got repealed, that really changed what the alcohol landscape looked like across Colorado, even though the number of licenses maybe didn't change. So I don't have that I haven't mapped that data from that far back, but that's just like one example of how that could affect it. And then also this is really like version 1.0 of this project. So I'm hoping to continue adding years of data as we go. I should have mentioned this earlier, but all of that licensing data is from 2020. So I pull January data, and that was January 2020 licensee information. I do have in my own files the data for 2022, and I can just say that it hasn't really, like, it didn't really change much from 2020 to 2022. So that's sort of another step, is like, how often should we update the story map and things like that. And before I totally stop talking to you, I have to give the disclaimer that my position and this project are supported by a cooperative agreement with the CDC, but everything that I said today is my own view and work and doesn't represent the opinions of the government. So I have a couple of just like thought questions here, but I'm happy to hear what other folks want to know about, or any other questions or discussion points.
Yeah, if anyone has any questions generally for Julia, you're welcome to drop them in the chat, or you can raise your hand and ask her. Give it a minute, and then we can also dive into your thought questions, Julia. While people are noodling over their questions, I do have a question myself. Did you guys see any like additional hits on the website as this last election was moving forward and alcohol-related measures were on the ballot?
That's a really good question. I don't know. I don't know the answer to that. So we track the website mostly for like our annual review for our cooperative agreement, but that's a really good idea, and we can go in and check and see what that looked like. I can say that no one really reached out to me about it, you know, asking like, what does that density look like here? I do know that in their like sort of fiscal note that the Liquor Enforcement Division had to submit for the wine and grocery stores ballot measure, I can't remember what it was called. They did report like the number of licenses that would be automatically converted if that passes. So in a way, I mean, that was just like the count. That wasn't like the density by any means, but yeah, but I should check the website and see if anyone did.
Yeah, I'd be really curious to see if there were any folks who were kind of, you know, researching and ended up on your website. Also, it would be kind of interesting to think through in the future, you know, as this inevitably comes back up on the ballots, if you could kind of do like a projection version of the map, maybe, of like, this is what the density could look like if, you know, these measures passed.
Yeah,
for future you.
yeah, right. That is something that I'm interested in, not necessarily in the projection, or that's just not something I've thought about yet, but just looking at like, how do changing policies over time like affect these factors that we know affect excessive drinking and potentially like injuries, etc. Okay, I see a question in the chat. Knowing that alcohol sales increase profits and retailers and especially restaurants, how will Colorado continue to monitor alcohol sales or access to what can be revenue for taxes? How will Colorado balance that moving forward? So the question of how will Colorado balance that moving forward is a great question. I don't think I'm the person to answer that, but I think that you're right. Like a big part of you know, this like narrative around the alcohol industry and retailers is that like they are businesses, and many of them are owned by local people, and so the point of this is not to like villainize them in any means. I will say that just objectively, Colorado has one of the lowest alcohol excise taxes in the entire country. And we could go into that topic as like a whole nother presentation, but our excise tax on alcohol has not been increased in decades. And we, just like most like government enforcement agencies, the Liquor Enforcement Division is, I don't want to say they struggle. I think they do a very good job with what they're tasked with, but every year as we change these policies, we're asking them to do more and more with the same amount of money, right? So the other thing about alcohol taxes is that we use them to fund the Liquor Enforcement Division, but it's not like marijuana taxes where we're using some of that money to pay for prevention. So I don't know if that answers your question, Tim, but those are some of my thoughts on it. Okay. It would be interesting to do the same kind of thing for nicotine and retail marijuana outlets and see how they compare, especially marijuana, since it's much newer to being legalized and regulated. I agree. I think there are political reasons why we haven't done it with marijuana. That's all I'll say on that. And then the tobacco team at CDPHE has done some mapping for tobacco retailers. And I have to dig up the link, but I'll try to share that after this discussion. And okay, are there other data sources, public safety, law enforcement, et cetera, that you recommend or have seen community level professionals use to understand it, or how alcohol outlet density could be resulting in community issues? Yes, so I'm working with the Colorado State Patrol to try to use some of their fatal crash data to try to like compare that with outlet density. It's not public because, you know, obviously I have to like honor like their data and everything first, but if anyone else in the call, I know there's someone in the call who has used outlet density in their own community, and I think compared it to some other of these like law enforcement or public safety concerns that you're alluding to, Peter, but I don't want to call them out. So if anyone has used this and wants to talk about their own project, then I think it would be interesting to hear from them.
Julia, oops, go ahead.
Go ahead.
Oh, I was just going to say, like, in terms of communities using it, I think this is where we just need to do a better, I mean, I think Julia has done a lot and we've tried to help the communities understand, but as Julia knows, it's really complicated. We went through years of trying to figure out how to best word all of this so that it was understandable. And Julia and Casey, who was also working on this project, have done a great job. But I think it's more now, how do we get the information out to help communities plan and know, what outlets are out there around in their community, because that does impact, the sales and all of that stuff and where it's at, and, it ties to all different things. So I think what we're always struggling with is how do we get communities to use this data more to help them inform their strategies. So if you have any ideas on that, that would be great. But we have had some communities like use it in terms of kind of doing some, for instance, I want to say simpler things towards policy work, such as having youth go and do a scan to see how many outlets are in their community, and how does this impact the youth in their community. And then I just want to also touch base on the taxes. It's a heavy topic. It's something that we keep bringing up, At one point, we had the AG's office interested in it, but then it went away because Julia can attest to this, but there's a very strong alcohol industry, and we just need a strong kind of community lens to help push that and say, you know, hey, we have a lot of alcohol issues here in Colorado, you know, and there's money that needs to be put towards prevention, just like marijuana. Can we take some of the tax money to put it towards prevention? But we haven't been able to get enough interest in that. So, you know, anything you can think of to help with that too.
Yeah.
Great.
Yeah. So, so you asked about the taxes, and you asked about like how locals can use this. So don't let me forget those two things. So I'm going to start with how locals can use this. I think kind of like I mentioned before, like using it in a community health assessment, or honestly, like I think a first step, which like it seems so simple, but like just using the measures that I've already calculated and reporting them in your community health assessment, or when some of these like projects or things start happening, I think like that could be a first step, because I think part of it is just like getting awareness around like, hey, we want to, like, this is an important issue for our community and we want to monitor it, because we don't want to like wake up in 10 years and all of a sudden like every single store sells alcohol, right? The other thing is, I mentioned at the beginning that to a certain extent, we do have laws around regulating alcohol density in Colorado, and I have checked, and so the distance requirement between schools at the state level is 1,500 feet. And so far, it looks like we do follow that. Like, I didn't find any retailers that were within 1,500 feet of schools. But that's just the state policy. So local licensing and zoning authorities can create other rules around like where they want licenses to go, you know, how many of a certain type of license they think they should have in their community. You know, like each of these different retailers operate under a certain license that dictates like what they're allowed to sell, like the hours that they're allowed to sell it, et cetera. So those are other ways that like local licensing and zoning can affect it. Another thing too, and this is a big lift, but is important, I think, is that the Liquor Enforcement Division's like rulemaking meetings that they have every year are open to the public, and you can submit comments on the rules that they want to propose. And one of the like mission statements of the Liquor Enforcement Division is public safety. So you can communicate that with them. I've been in those meetings, and there's a lot of voice from alcohol industry, and they're all lawyers. And so I think it would be good to have more community voice and public health voice in those settings. I will put a link in the chat for that site, and they have like a bulletin, I think is what they call it. It's like a newsletter that goes out whenever they're going to have those meetings. I will say that the rulemaking session for this year ended. So usually like after the General Assembly ends, they convene the rulemaking session, just as an FYI, but I'll put a link in the chat for that. And then what was the other question that you asked, Sharon? Sorry. It was about taxes, right?
Yeah, it was more like a comment, but just saying how we've attempted to raise awareness about taxes and how hard it is in this state to do that. Yeah,
so I think it's an important distinction to make between taxes and price. So the community guide recommends increasing taxes on alcohol, and that's because that's the literature that they've reviewed, and so that's the recommendation they can give. But we do know through the research that young people are most sensitive to price of substances, and so increasing the price of alcohol could potentially reduce underage or like risky drinking in those populations. And so alcohol excise tax is preempted at the local level, which means we collect excise tax from wholesalers at the state level, and localities are not allowed to collect a second excise tax. There are other ways to affect price. Some states and jurisdictions use an additional sales tax called like an ad valorem sales tax. Some places have tried instituting minimum unit pricing. Scotland got a lot of attention recently because in 2020 they introduced a minimum unit pricing for alcohol, which basically shows that like for each, or the way they wrote it is that depending on the percentage of alcohol that's in the product, you can't charge less than a certain amount. And so that kind of helps with like happy hours and like some of these like discounted alcohols or alcohols that are really attractive to youth, like For Loco and some of these products that are, I mean, to just be like perfectly frank, like they're being very predatory towards young and inexperienced drinkers, right? So, so there are other ways to affect some of these policies that aren't excise tax. And so I don't know what all of the answers are of like how communities should do that, but I think that those are some options that folks could explore. And that's why I think that like starting to talk about outlet density and like what products are available, like Sharon, you kind of described like an environmental scan earlier of like youth going into places and seeing like what is available at eye level and things like that. Those can be ways to sort of like start this conversation. And also I think it's really important that we talk about like what places are doing good things, right? Like if you do an environmental scan and you find like, oh, all of these places are operating pretty responsibly, they're not putting a bunch of like marketing materials on their windows, or they have a separate section of the store for liquor that like kids don't go into or whatever. We don't sell liquor in grocery stores here, but you get my point. Let's celebrate that, right? Like it doesn't all have to be negative and like villainizing. It can also be like pointing out the places that are doing good to encourage other businesses to want to like get that shiny star, right? And thank you, Sharon, for putting the liquor advisory group in the chat. I might find another link for that as well. Okay, so this link goes to the Liquor Enforcement Division's website. If you scroll all the way down to the bottom, there's a section called LED updates. And under division information, there's like a button to subscribe to general liquor industry updates. And they'll send stuff that just has to do with like, this license has been suspended, don't deliver to them. So some of it may not be relevant to you, but they'll also tell you when they're like, they'll send a bulletin when they're doing like meetings. And they don't send a lot of emails. It's like I get one every couple months probably. Also, I do want to call out that the Liquor Enforcement Division in Colorado does a really good job, and they have 20 enforcement agents for over 15,000 licenses across the state, and they really do care about public safety. So, you know, they've been like a really amazing partner, like working with their data, and they, their liquor enforcement agents have seen the Storymap, and from what I've been told, they like use it to strategize like where they're gonna attempt their like compliance checks and things like that. So, you know, that's part of the ongoing evaluation of this project is like, is it useful to them, whatever. But I think they've been like a great state partner.
All right, any follow-up questions for Juliet? Any ways that you all have used similar data or this data in your own communities that you want to share? Awesome. Well, thank you so much, Julia. This is really interesting. We really appreciate you presenting today. Okay, we will cruise on to our final updates. Oops. All right, so we want to thank you all for attending today and engaging with us. Please continue to share any data reports, findings, news, things of that sort for the SEOW newsletter with our coordinator email that was on the first slide. Send any inquiries that you have about adding any additional things to the website to that same email as well. And please remember to participate in our post-meeting survey and then continue suggesting any topics for briefs that you can be the subject matter expert for. Our next meeting is in the new year in January, and it'll be on data linkage projects with the Colorado Evaluation and Action Lab. So we will see you all then. Thank you all so much for attending, and thanks again to Julia. Take care, everyone.